Stephen, ladies and gentlemen, thank you for that generous and undeserved introduction. But I want to begin my remarks this morning with a quotation from Charles Dickens. It was the best of times, it was the worst of times, it was the age of wisdom, it was the age of foolishness, it was the epoch of belief, it was the epoch of incredulity, it was the season of light, it was the season of darkness, it was the spring of hope, it was the winter of despair. Quite apart from the obvious link to the wider European context, and I shall come back to that, the opening lines of The Tale of Two Cities, I think, have a compelling resonance as we reflect on the state of the NHS and the wider care sector today. So much of our daily experience in the sector is truly inspirational. Whether it's the young care assistant who provides support to an elderly man who was her age in the year that the Queen came to the throne, but who now suffers from dementia, or the paramedic who was called to deal with a dying woman and her distraught children after she was stabbed by her abusive partner, or the award-winning team which delivers a stroke service, which saves and enriches lives which until very recently would either have been cut short or greatly diminished. All of these examples, and literally millions more, are the daily experience of those of us who are privileged enough to work in our health and care sector. And it's, of course, the professional staff, the caring professions, the nurses, the doctors, the healthcare assistants, as well as the social workers and the full range of clinical and caring professions who deliver this highly personal service. These are the people who enrich the lives of those they touch and on whom we all depend for the health and care sector we want to see. But it isn't just the caring professionals. Modern healthcare is built on teamwork. A surgeon can't work without an anaesthetist. No more can a hospital work without the networks of support both to ensure the efficient running of the hospital and, even more importantly, very often, to link the hospital into its wider community, including the complex networks of carers and third sector organizations which together provide the indispensable foundations of our society. So the inspirational stories of patient experience are not the exclusive property of any individual or group of individuals. They're the result of successful teamwork and successful organizations, which is why it's important to begin this conference by restating yet again the vital role played in this story by the management community. Managers are not a cost borne by the healthcare team. They are part of the team, an indispensable part of the team, and part of its success. And it can never be too often stated that it's the inspirational stories that get the whole team, including the managers, out of bed in the morning. People work in this sector in whatever role they fulfill because they want to be part of a team which delivers high-quality health and care. And it's this commitment to building teams which will be the centerpiece of this conference. As everyone here knows, I was part of the government that originally introduced the concept of an NHS trust, and I later supported the development of foundation trusts because I think it's important that complex organizations are properly managed. But I've never supported the view that healthcare can be reduced to a series of unrelated transactions. And I've always argued that good health policy requires the institutions of the NHS to be fully embedded in their local health economy and even more widely in their local community. And there's no better place to discuss this need for a more joined-up approach to health policy than here in Manchester. I'm delighted that I shall be followed onto this platform this afternoon even, by Sir Howard Bernstein, Chief Executive of the City Council here in Manchester and Principal Architect of Devo Mank. Sir Howard was an early champion of the important principle that good health policy is local health policy and that it's about so much more than service delivery. It should go without saying that there need to be better links between health and social care, and indeed within the NHS itself. But that's only half the story. Good local government is about creating sustainable communities in which people lead full and fulfilling lives. And health policy in its widest sense should be at the heart of that sense of civic ambition. But although there's something fitting about this conference coming to Manchester, the requirement to build a place-based approach to health policy is definitely not unique to Manchester. I say that for myself as the independent chair of the Birmingham and Solihull STP, and there's always been a whiff of friendly rivalry along the M6. But more importantly, I say it on behalf of all 44 STPs. We've heard it said too often. Our services are fragmented. We pay for activity, not outcomes. We treat conditions, not people. We protect structures, not patients. Too often we find ourselves responding to the urgent rather than dealing with the important. And we don't use the information and the opportunities which are open to us to prevent or to delay the onset of illness or to provide proper caring and support services. The result of this is that our citizens become ill unnecessarily, with the inevitable result that resources which could have been used to enable people to lead more fulfilling lives have to be used to treat people who need not have been ill and should never have been allowed to become ill. I think the STP process is an opportunity to rewrite these rules. Rather than being stuck in sterile debates between primary and secondary care, healthcare and social care, commissioners and providers, the planning guidance issues us with a challenge. I quote, "Planning by individual institutions will increasingly be supplemented by planning by place for local populations." It's what many in the health and care system have been seeking for years. An end to top-down disorganisation and the opportunity to reach beyond the silo to create joined-up services which address the needs of local people. We should be clear about the implications of this approach. It requires each of us in this hall, to think differently. It requires us to address entrenched local cultures and habits and create new alliances within the NHS and beyond the NHS with local government and other local partners. It requires the NHS to come down off the hill. But if it requires different behaviours at local level, it also has important implications for the national bodies. They cannot will the end, which I believe they do, of more localised place-based services without willing the means. They too have to learn new behaviours if they're going to create the space to allow this to happen. Of course, it's true, national visibility and accountability for both finance and care quality will always remain important commitments of the NHS. But the central purpose of the place-based agenda is to empower local health economies and the wider local community well beyond the traditional NHS to improve health outcomes and life chances for local populations. The NHS Confederation supports this development, and we shall align ourselves with our member organisations to enlarge the opportunities which these welcome developments create for local decision-making. We shall also liaise with the national bodies to ensure that the potential of these developments is not lost in well-meaning oversight. While we reflect on the challenges we face at home, we should also, and I think the Confederation has a role to play in this, ensure that we understand that the challenges we face here are not unique to the United Kingdom. Later this afternoon, we shall hear from Jason Helgeson, the Director of Medicaid in the state of New York. Jason will tell the story of how better information systems, more joined-up services, familiar themes to all of us, have ensured that the state of New York is able to use taxpayer dollars to improve life's chances for tens of thousands of its citizens. I think we should be interested in that story and challenge ourselves to apply some of the learning for the benefit of our own citizens. So, there's a huge amount for us to celebrate, and we should not be backward in celebrating it. We employ great people. We deliver great care. There is more agreement about the policy framework than we've seen for many years. But I did start with a quotation from Dickens in order to signal from the beginning of what I had to say that in parallel with this story, there's another tale and another city. And in that city, the growth of health and care services is not seen as evidence of a vibrant sector meeting the needs of a changing society. It's seen as evidence of a growing burden which poses problems of both value and affordability. In that city, they think of economic growth as something distinct from health and care services and believe it's necessary to constrain the growth of health and care services in order to facilitate growth elsewhere. The NHS Confederation has argued, and so long as I have anything to do with it, will argue, that that's not just bad social policy, it's also economically illiterate. We should be crystal clear. It's not a question of wealth creators in one corner and caring professions in the other. There's no purer form of wealth than human health and human fulfillment. And health and care services linked with life sciences are a vital part of a growing, wealth-creating, successful society. So while we understand that public finances need to be sustainable and that it's for Parliament to make decisions about tax and spend, we do not accept that it's either realistic or desirable to plan on the assumption that provision of health and care services should grow more slowly for the whole of this decade than the average of other forms of economic activity in Britain. What's the basis on which anyone could make such an assumption? Is demand for our services growing more slowly than demand in other parts of the economy? Is there evidence that the pace of technology-driven change is slowing down in our sector, or that these changes will offer us the opportunity to meet demand at substantially lower cost? These are rhetorical questions. We all know the answers. No prediction is completely certain, but we know it's likely that the answer is no, which is why the assumption that health and care services should grow more slowly than the rest of the economy will, in my view, become more and more obviously sustainable as the months go by. And the NHS Confederation will not shirk the responsibility of pointing that out on behalf of its members, but more important still, on behalf of the citizens we all serve. Talk of resources brings me to the EU referendum. As I've just said, no prediction is completely certain, but the Institute of Fiscal Studies has spent decades building its reputation as an independent commentator on the state of Britain's economy. It does not put that reputation at the service of this or any other government. It was therefore a matter of direct importance to every one of us, I believe, when the IFS studied the implications of Brexit for economic growth in Britain and found that, and I quote, "There is an overwhelming consensus that it would reduce national income in both the short and the long runs." That's us they're talking about. Reduced national income in both the short and the long runs. The IFS concluded that the effect of Brexit would be that by 2020, either taxes would have to be higher or spending would have to be lower by between 20 and 40 billion pounds per annum compared with current plans. These numbers completely neutralise the speculative saving of up to 8 billion in our contribution to the EU budget if Britain were to leave the EU. And they expose the extent to which Brexit represents a threat for the health and care sector. No wonder the BMJ, in the article that Anita just referred to, concludes, and again I quote, "The Leave campaign arguments on the NHS are simply wrong." Far from providing an opportunity to increase NHS funding, it is, as Sarah Wollaston pointed out last week, overwhelmingly more likely that Brexit would further undermine the finances of a health and care sector which are already likely to become unsustainable. That is not Project Fear, that is telling the truth. But even without Brexit, questions around the funding and structure of health and care services will remain acute and become progressively more pressing. That's why I believe we need to find new ways to address them. Earlier this year, I joined Alan Milburn and Norman Lamb on a cross-party basis to propose that there should be a new cross-party commission to review these issues. That was not an attempt, as some suggested, to take health out of politics. I don't think that's either desirable or achievable. It was an attempt to create a more sophisticated political dialogue, both about funding and about structures, which recognizes that much of the analysis is shared across the political spectrum, but also recognizes that there's an urgent requirement to move beyond analysis paralysis and develop realistic options which we can carry out to secure our future. The proposal for a commission sits on the table, but whether or not it's taken up, these are issues which the NHS Confederation needs to engage in public argument, arguing the case for a flexible, growing health and care sector, arguing that on behalf, as I've already said, of the members of the Confederation and of the people we serve. Which brings me briefly and finally to some housekeeping about the role of the Confederation itself. I hope it's clear from what I've said today that I believe there's an urgent requirement for the health and care sector to work more collaboratively, to move beyond institutional silos and to shape itself around the needs of citizens. If it's to develop that agenda, the Confederation needs to enlist the active participation of representatives of a wide range of partner organisations, including the Local Government Association, Association of Directors of Social Services, the National Housing Federation, and representatives of the public health community, as well as the full range of voices within the NHS itself, including our current membership networks and other NHS organisations such as the National Association of Primary Care and NHS providers. The NHS Confederation cannot be and does not seek to be the voice of every member on every issue, but it can be and should be the voice of the sector as a whole in a national conversation about the future shape of health and care services. We're fortunate, as Stephen has already said, that Rob Webster was able, during his time as Chief Exec of the Confed, to establish us on this journey, based on his relationships, strong relationships of trust across the sector. And I think we should all be grateful to him for the foundations on which we are now able to build. And we're also fortunate that Stephen Dalton has agreed to fill the role of interim Chief Exec, developing the future shape of the Confederation. We shall launch a formal consultation with members in the autumn on the implications of this changing role for the Confed, at the same time as we restart the substantive process of recruiting the next Chief Executive. So this is a time of change for the Confederation, as it is for every one of our members. But the basics are clear. We draw our strength from the breadth of our membership connections and the clarity of our vision, and we aim to build a team of teams within the Confederation collaborating to make the case for the vision that I believe we overwhelmingly share. It's a mandate that I was given by the trustees when they invited me to be your chair. They did so on behalf of the membership of the Confederation, but more importantly, they did so because they know, as we all know, that it's the only way we can redeem our obligations to the people that we serve.
Thank you very much. So we are very fortunate that we are able to have a little bit of a chat, and I'm very happy to take questions from the floor as well. You will see people with well, what look like offensive weapons coming down. These are just boards so I can see where the questions are. If you have a question, please put your hand very clearly in the air. They will find you, and then I will find you. But just until we get some questions from the floor, Stephen Dorrell, let me start with you. This idea of Project Fear, you might have heard George Osborne this morning speaking to the Today programme and very much reiterating what you have said, that there will be a need for an austerity budget if there is an out vote. 57 of your own party members have said they would torpedo any such austerity budget. The opposition today at Prime Minister's questions have said they would torpedo any such austerity budget. Therefore, how can you be sure that this sort of NHS-ageddon is on the horizon if there is a vote out?
It's not my role to say what a Chancellor would do given circumstances that would arise in the event of exit from the EU. My role is simply to point out the arithmetic, and it doesn't matter whether you're a Labour MP or a Tory MP, whether you're doing the job I now do within the Confederation. What role you play, the laws of arithmetic apply to all of us. And if the IFS are right, and I've never heard anyone argue against them substantively, that the economic shock of leaving the EU would undermine growth in the short to medium term, the arithmetic says there would be less resource in the economy. As I said, we are part of the economy. And if the economy shrinks or doesn't grow as fast as we think it otherwise would, we suffer from that in the health and care sector, and the public sector, the Chancellor can only spend tax revenues that come to him. So if less tax revenue comes in, he either has to cut or he has to raise tax rates.
So I mean, this is well-trodden territory, but I will ask you what others have been asked, what Boris Johnson is often asked. And he also says, I have arithmetic on my side. He says, the moment we take control of our borders, we take control of the number of people coming in, we take control of the number of people putting pressures on services that these people work in out here. Why is he wrong?
I'm not commenting on the immigration issues. I think that's beyond the role of the NHS Confederation, except, of course, to the extent that the NHS is important numbers of people working for the NHS are EU immigrants. But beyond that, that's a political question. What I'm seeking to focus on in what I've said this morning and in response to this question is the economic issue. Meeting rising demand for health and care services requires resources. If the economy grows more slowly, there will be fewer resources to meet that rising demand. There's still choices to be made within society about how much we have as tax. All of those things remain true. But if the economy is smaller, the cake is smaller, there's less to go round. Fact.
Stephen Dalton, one thing that we are certain of, we don't know what's going to happen in 8 days' time, but we can be sure that we are in for an uncertain time, no matter what happens, whichever way this goes. And yet there is a certainty about the year 2020, that LGA document that you have produced today, gives people a very concrete deadline. How will that work? When the sand seems to be shifting under everybody's feet, how is it that this concrete deadline can be realised?
Well, I think that when well, the sands are shifting, and I think it's our job at the Confederation to consider the answer to that question in part a week on Friday, because I think that will, depending on the vote, it's going to be a game changer. And it's going to be a degrees of difficulty, I think, is what we're going to be facing. Our role in the Confederation is to absolutely act firstly on behalf of those people who use NHS-funded services, and secondly, on behalf of those people who commission them and provide them. And that's what we're most interested in. Happily, we live in a democracy, so we don't want to influence the democratic vote. But all the evidence, as Stephen has repeatedly said, and we're just following the evidence, all the evidence is that 2020 time, that perhaps the years in between that time are going to be much harder if indeed the vote is to leave. If the vote is to leave, we'll have to deal with that. But we think we have a responsibility to people who use services and people who commission and provide services to be unequivocal about this, is that the evidence, the weight of evidence, is that journey is going to be much harder towards 2020.
Let's take a question. Yes, number 6 over there, please.
Thank you. I'm Amit Bhargava. I'm a GP and Clinical Chief Officer for Crawley CCG. It's about the STP, and I completely agree with Stephen Dorrell's view on the roles, responsibilities, and the values that the STP could create. What would be the role of the Confed when the 44 STPs do not live to those values or veer away into the charted waters we've traveled before and failed at?
Should I go first on that? I think the Confed can't guarantee perfection in every STP. We all know that. So I think the role of the Confed is firstly to support the development of individual STPs and to be a resource to those who are seeking to develop a more holistic, joined-up view of healthcare and public services in the STP context. That's the first thing. The second thing is to be a reminder, as I hinted during my remarks, of the need to ensure that the national bodies allow space for the STP process to work. The third thing I think the Confed can do is to be a meeting place where people can share their experiences, because this is relatively uncharted territory. And there is great opportunity for people working in an STP context to share their experiences, both within, and I keep coming back to this point, beyond the NHS. I mention again Howard Bernstein next on this platform, engaging as a civic leader, man who spent his career in the service of local government, engaging with the health service in a way that I think the NHS has been impoverished in recent years by the weakness of those links. We need links in the locality outside the NHS, and we also need within the Confederation the opportunity to share experience and to ensure that that not just that the STP leads and their partners all walk the walk, but that the national bodies do too.
Somebody said I was fairly straight talking, so let me call it out. If anybody behaves in a way that this is about a land grab, about who's in charge, it won't work. And if anybody wants to argue with me that the NHS is going to fix itself without the help of all the other determinants and the people who influence the determinants of healthcare, well, you can meet me outside.
That sounds very threatening. Yeah.
Because we'll have that discussion, because we haven't got time for it now. That's what I meant.
Okay.
But quite frankly, I haven't met anybody within the NHS, whether in commissioning or within provision, who actually would argue that we've got a good history of fixing this by just focusing internally. But it is really important that this isn't about saying this is about the local authority taking over. Let me call that out. It's not about the local authority, and if anybody in local authorities thinks it is, then they're mistaken too. So that's not what we're talking about. We're talking about we've really got to set these things aside now. We really have to move on, because actually we're in a bit of trouble.
I know there are other questions, and we are running out of time, but these gentlemen are going to be around, I'm right in saying, throughout today, and are very happy to speak to you outside, and possibly won't punch you if you ask a question. But I have just a very brief question for you. Stephen Dorrell, we were chatting before in the green room, and it's all very well to have a document. You yourself have a background in nursing before 17 years of being an NHS chief executive. So you know coalface and you know high table. For the high table ideas to work at the coalface, you are going to have to rely on flesh and blood human beings who face unspeakable challenges every single day. And lest we needed reminding of that, we will have all seen on our screens those first responders turning up to Orlando. And also this is an anniversary, it just happens to be an anniversary of an event that happened right here, Stephen, isn't that right?
That's right, and so for those who haven't picked this up yet, this is the 20th anniversary of a bomb exploding in the middle of Manchester, and that causing massive devastation, and 200 people actually got injured in that bomb. And I think it's fitting that we're in Manchester. And I think it's also that in those times, and we've seen other atrocities in this country and across the globe, I think it's in those times that it's these people in the room who we rely on. It's the people on the front line of delivering services. It's the people who commission those services. That's who we're relying on. And that's what gets these people out of bed in the morning.
Well, that is what we are going to be talking about throughout this conference. As I say, these conferences tend to coalesce around a theme, and it is that theme of getting individuals who face these challenges on a daily basis to sign up to the big thinking ideas. But since we have brought it up, it might be a good opportunity just to take a moment to remember those who fell in Orlando and those who fight every day in such atrocious circumstances. So please join with me just for a moment's silence. Thank you all very much indeed. And thank you, please join with me in thanking, I was going to sort of say Stevie D and Stevie D, but that just cheapens their enormously important roles. But please join with Stephen Dorrell and Stephen Dalton. Good on, Stephen. So, I mean, the reason it was important to sort of think about those people who are on the front line is because it is that transition from idea to implementation that is all important. If you've got a concrete deadline, then you need your troops to walk in step to reach that point. And 2020 is the milestone that has been created. So how do we do that? Well, we've got an excellent panel to discuss this.